so our presentation is on Wasatch Behavioral Health. So this is a resource here in Utah County. The closest location is just on Freedom Boulevard in Provo. This is the phone number that you can call and a website you can visit, and they're open Monday through Friday from 8 a.m. to 5 p.m. So the way that you find out about Wasatch Behavioral Health is that it is the designated mental health provider for Medicaid holders in Utah County. So if somebody living in Utah County calls wanting mental health help, they would be referred directly to Wasatch Behavioral Health. They're able to set an appointment either online or by coming into the office, and there are walk-in visits available for patients that are wanting services, or anybody that's in crisis in the moment can also just come in and receive services. Eligibility, as mentioned, it is the Medicaid mental health provider, so people who have Medicaid are eligible. However, they do have an outreach group called Mountain Peak Counseling that offers therapy for those that have private insurance or would like to pay with cash. And this is also a really accessible service because no referral is required to come.
All right, a few of the services that are provided are crisis services. You can also reach out through your mobile as well. And they also have youth crisis services, receiving center, and just like we said, anyone can receive that service as well in any time. They also have Mountain Peaks Counseling, substance use disorder services, family clinics, psychological assessment services, autism preschool, strengthening families program, jail transition program, resources for Spanish speakers as well. A few barriers to access are funding. If a community member who wishes to utilize the resources but have no insurance, it can be difficult to use. However, there are times when grants are available to provide funding for that person. And another one could be time, because the resources being in high demand, it could be a longer wait period for the people to be seen by professionals that work with the agency. And also with private insurance, because this facility gives priority to those who are using Medicaid, those with private insurances usually don't have access to all the resources that are available.
And the reason for that is how the agency is funded. So like we've said, it is the Medicaid provider for mental health, and that is because they receive all their funding through Medicaid reimbursements. And so there are a few different Medicaid plans that people can have, and the ones that are accepted here are traditional Medicaid and non-traditional Medicaid. Either of those will be accepted at Wasatch Behavioral Health. The only difference is that the non-traditional Medicaid will occasionally limit the amount of visits that you are allowed in a year. And so that's typically around 30 visits per year if you have that non-traditional Medicaid. And then there's also PCN Medicaid, which is a yellow card, and that does not include mental health benefits. And so that is not accepted at Wasatch Behavioral Health. But like we've mentioned, there are occasional scholarships, and clients can self-pay, but private insurances are usually not accepted.
Okay, and then some additional information or resources. Wasatch Behavioral Health has 6 family clinic locations across Utah County, so it is very accessible in Utah County. It's not just in Provo. And then there's currently 4 children and teen programs that are seeking volunteers. So if you're looking for somewhere to volunteer in the mental health field, especially with teen and kids, this is a great place to look. And then there is 24/7 crisis services, so if someone is in need of help immediately, they're not limited to those hours of operation during the day. And then we just put that website back up there for anyone that wants to learn more. And then our professional evaluation of Wasatch Behavioral Health, we believe that it is a public comprehensive behavioral health center providing a variety of services designed to meet the needs of children, youth, adults, and their families. Services include, but are not limited to, individual therapy, family therapy, group therapy, substance use disorder counseling, case management, residential services, 24-hour crisis response, prevention, various resources, and more. And then it's a great resource that is distributed throughout the community for anyone who's in need or in crisis. So it's a really great place. Even with some of those barriers to access, we believe it's an awesome institution, and it provides the services that it's designed to.
Thank you
for watching.